Hi everybody, it's Liz, and it's been quite a while since I have made a video. There's a good reason for that. I'm not doing very well. It's nothing life or death at this point, but I am having a difficult time with my graft versus host, and I'll explain it first. First of all, my legs are getting worse. They are bubbling. I have bubbling of the skin, and I don't know how else to describe it. They're not blisters anymore. I still have those blisters. They look like blood blisters, but I also now am having large bubbles form on my skin, and it's difficult and it's painful. There's nothing I don't think that we can do yet. My doctors have put me back on methotrexate, which I'm not a fan of. I have been losing a lot of my hair, and it makes me feel pretty crappy in general. They also put me back on Jacophy, and we're hoping to get the graft versus host under control so that I can come off of prednisone. And I'm down to 5 milligrams right now on my prednisone. Back to my legs. So there's spots on my legs that started to get dry, even though I'm lotioning them and keeping the skin as soft as I possibly can. They were getting really dry, and then the dry spots opened up and started to weep, and some of them started to bleed, and so they were open sores. And so I went to the wound clinic. I went 3 or 4 times. We put a combination of clobetasol and aquifer on the wounds, and this is my one piece of good news, is that the wounds have healed, and so that has been great. Aside from that, though, the graft versus host has progressed, and I'm having a hard time moving. My joints have been affected. I'll show you here in a second that I don't have quite the range of motion that I used to have, which affects everything from walking to getting dressed, everything. So here's me trying to put my arm up over my head, and you're going to see my chubby arms, but it's really, really difficult. Between the hard skin and the joint problems, it's painful and it's hard to do. So anyway, that's one thing that I've been dealing with. I have been going to physical therapy. People have just been saying you got to keep moving to keep your mobility, but I'm finding that even the physical therapy isn't helping, and that I'm losing more and more mobility every day. The pain has gotten pretty bad, and I'm really lucky that I have a oncology team that, excuse me, you're not boring, I promise. I have an oncology team that has been helping me manage my pain. I take Oxy 5 milligrams about every 4 to 6 hours, usually every 6 hours. And that just takes the edge off so that I can get from place to place. I can get things done around the house if I need to. Although, to be completely honest, Rowdy does most everything because I can't move the way I used to. I can't stand for long periods of time. So like things like cooking dinner are really, really difficult for me and painful. So anyway, it's affected my walking. And part of that has to do with the skin getting so tight on my backside and my lower back, so that I can't stand up straight and walk with correct posture. My hips are killing me. Whether I sit, stand, lay, I'm having a really hard time with the hips. I'm trying to think. Oh, the other thing that's really been bothering me is my breathing. I have a hard time catching my breath. I apologize. I have a hard time catching my breath. So, even if I have to walk across the house from the living room to the kitchen, I get really short of breath. And Rowdy's afraid that I'm going to stop breathing in my sleep. He listens to me breathe in my sleep, and it's not good. So, we checked out my lungs. Lung function looks fine. We've checked out my heart. We did a stress test on my heart, and my heart seems to look and function just fine. They're not sure what's causing the shortness of breath. I personally think, and so does my pulmonologist, that the tissue on my chest has grown so big and it's so heavy that with the constricting and the tightness of the graft versus host, that I can't get a decent breath in. And so I talked to my team about going in for a double mastectomy, just because it is a huge problem. They do bother me a lot, and they are very, very painful. I can't believe I'm going to do this, but I'm going to show you just the tops of the breasts, just so that you can see. Don't worry, I'm not going to take off all my underwear. You're not going to see anything exciting, but trust me, there's nothing exciting to see. But I'm going to show you the tops so that you can see exactly what I'm dealing with. And here. So I don't know if you can see the contour, but they're lumpy and bumpy. And you can see on this side too. Also, you can see that the tissue is hard clear up to here, and it's not like normal breast tissue. It's not soft. It's really hard. People ask me all the time if I have implants, and I don't. I don't have to wear a bra with support. I only wear like sports bra kind of things, just because it's more comfortable on the graft versus host skin, and it provides the coverage that I need. So anyway, my team sent in a referral for me to talk to a surgeon about getting a double mastectomy. Unfortunately, because of the scleroderma of my skin and the graft versus host, no surgeon will operate on me, just because they're afraid that the wounds won't close. So that's my update. I wanted to say thank you to the people who have been leaving me comments. Sorry, I'm gonna cry. I'm trying not to cry on all these videos. I really appreciate the kind words. Just getting from day to day is really difficult sometimes. And for those of you who have said that I'm doing fine, that I can make it through the hard times, and that there are things to look forward to, I really appreciate it. So, please, I'm sorry I'm crying. I'm trying not to. If you feel so inclined, please leave me a comment, and I hope everybody has a great day. Thanks.